Assalamualaikum everyone, and welcome to the new video of the Analgesic series, which belongs to the drug series. So today we are going to discuss the Naproxen, that is another analgesic. So let's begin the video. Naproxen is basically the propionic acid derivative, and this is the chemical classification of these drugs. While its therapeutic classification, it belongs to the analgesic family. It is acid in nature, as you can see in the picture, the propionic acid. That's why it is known as the propionic acid derivative. Now, what is the mechanism of action? Naproxen worked by reversibly inhibiting both the COX-1 and the COX-2 enzyme as a non-selective coxib. That means it inhibits both COX-1 and COX-2 pathway. Non-selective means it blocks the COX-1 and COX-2 both in the reversible manner. This results in the inhibition of the prostaglandin synthesis. Prostaglandins, that are the PGs, act as a signaling molecule in the inducing the inflammation. Thus, by inhibiting the COX-1 and 1,2, naproxen induces the anti-inflammatory effects. Why? Because it inhibits the both COX-1 and COX-2 pathway. So what is the propionic acid derivative? Obviously it contains the group that is a propionic acid. That's why it is a propionic acid derivatives. By the little modification, it produces the derivatives. So the backbone structure of all the propionic acid derivative are obviously the propionic acid. And some example drug in the propionic acid derivative are ibuprofen, naproxen, ketoprofen, ibuprofen. That will be the next drug in the drug series. And ibuprofen, we described this drug previously. If you didn't see that video, then first go and check out this. Now, analgesic, antipyretic and anti-inflammatory efficacy is lower than aspirin. Why? Because of the lower potency. All inhibits the PG synthesis, and most potent are the naproxen. And now, if we are talking about the antiplatelet activity, it have the longer activity. Which drug having the longer antiplatelet activity? That is obviously the naproxen, because of the most potent drug. Now, if you are talking about the adverse effect of all the propionic acid derivatives, so these are some common adverse effect: better tolerance than aspirin and indomethacin, milder GI discomfort, nausea, vomiting, gastric erosion rarely. CNS effect, all of the CNS effect: headache, dizziness, blurring of the vision, tinnitus and the depression. Rash, itching and hypersensitivity are less. And precipitate aspirin-induced asthma. Aspirin-induced asthma is obviously caused by the aspirin only. If we are talking about the pharmacokinetics of the drug, all are the well absorbed orally, 90 to 99% plasma protein bound with a lesser displacement of all the drug, and inhibit the platelet function. Used with anticoagulants are avoided because it gives the synergistic effect. Decreases the antihypertensive and diuretic action of the furosemide, thiazide and beta blockers, because it having the interaction with these drugs and with these classes. Uses: not given in pregnancy and peptic ulcer patient. Ibuprofen, as I described previously in the previous video, so go and check out this. In this video, we are actually talking about the naproxen. It is preferred in the acute gout condition. So the major indications of the naproxen is acute gout, because it is a stronger anti-inflammatory and inhibition of the leukocyte migration with a longer half-life, that is 12 to 16 hours. Okay, this is basically the mechanism of action of NSAIDs, and I described this mechanism hundred of times. So one more time I describe this mechanism. If you have any confusion about the mechanism of NSAIDs, so go through the previous video and check out this. I describe the mechanism of action with their particular effects on the organs. So one more time, what happened with the NSAIDs? With the injurious stimulus, cell produce the arachidonic acid by the two pathway, that is a COX and the LOX pathway. By the COX pathway, it produces the prostaglandin, that are basically the local hormone present in our body, endogenous, ultimately. So it have role in the inflammation, in the hypothalamic temperature control, and the painful stimulus. So what are the purpose of NSAIDs? NSAIDs inhibit the COX pathway. When there is no COX, there is no COX pathway, no PG. So ultimately it have role in the fever control. That why it is antipyretic. It inhibit the process of inflammation. That's why it is anti-inflammatory. And obviously it stop the painful stimulus. That why it is analgesic. And these are the some common side effects of the naproxen, that is a diarrhea, constipation, gas, mouth sores, drowsiness, heartburn, dizziness or lightheaded, and these are all the CNS effect, hearing problem or the ringing in the ear, tingling in the arms and the legs, trouble falling, sleeping or staying asleep, that means insomnia, and indigestion. So that's all from this video and from this drug. Inshallah meet with the new topic with a new drug in the next video. Till that, take care. Allah Hafiz.